more and more now when you go to conferences and this kind of stuff, you probably have seen what's right here, which is a hashtag. So you have, if you've gone to ICRE or any of your conferences, probably you see people talking about hashtag, how to use hashtag. So this is a hashtag. Hashtag allows you to filter stuff when on the internet, because there's so much tweets like happening right now that if you go, unfortunately there was a shooting in California. I don't know if you guys heard, you were here, so you didn't probably. But that's whole Twitter is about. So if you want to see what's happening here, you can use that hashtag to go to it. So for people who are interested, that's the hashtag for this session. You can follow it. I posted the PowerPoints there also. I do lots of e-learning stuff, so sometimes it relates to my Facebook and Twitter use, so I just wanted to be clear that I got funds from Lindbeck and CNFS for my research. Today, we're just going to talk a little bit about how doctors can use social media for education and also in practice. So let's be clear, social networking always existed. You always had your buddies, you always had your friends, you have like community of practice that you guys are together, and it just groups you because you have something that you guys are all interested in. Like the students are all interested into studying together, you guys are interested in the conference, you're talking about the new methods of treating UTI, you guys group together. It is a social network. What happened is the networks went online, right? There is a digital world that started to form. And the more this digital world and technology moved faster, the more the gap between the generations starts to get bigger. So if you look, it's actually changing how we communicate, the fact that we have a digital world out there. How does it go? Like here you have a greater generation, baby boomer, generation X, generation Y, right? These are the 4 categories you have in workplace. These are the people you're working with every day. These are usually the leaders. These are your medical students. These are the younger staff or residents, maybe between these two. So the technology they use is not that much important for what I'm talking about. Let's have a look here on the communication media. As you can see, before it used to be letters, then it went to the phone, then email came, and we still are using email as the main point in hospital and schools. But the truth is, more and more of this new generation that is coming is doing text messages. And many of you text message your residents. Many of you probably text message the students about the cases and this kind of stuff. This was one of the concerns when we were talking about CMPA with this, that there's lots of information being text left and right, and we don't know if it's all anonymized or not. I'm going to talk about it in a second. But the bottom line is, people are doing it. It's not it's going to go away. It's the new mean of people communicating to each other. So as communication is one of the CanMed's roles, I thought when this thing came up that we should start teaching students and residents and physicians how to communicate with these new tools, not just to say, oh, Facebook has lots of professional issues, lots of confidentiality stuff, let's stay away with it. It's nice to say that, but many people will be on it still, so let's teach them how to use it. The other thing that's very interesting is this. How do they prefer to communicate? Actually, it was face-to-face for this generation, mostly face-to-face for the boomers. It went to email and SMS, and now it's online. But the interesting thing is, for this new generation, is actually going back to face-to-face. Why? Because my generation, I'm an Xer, right? We had emails and text messaging. Email and text messaging, you don't see each other. The new generation that comes, they have Skype, they have FaceTime, they have Hangouts. So they actually like to see each other. Snapchat, that is a huge visual thing. So that's the interesting thing. Many boomers and people from Generation X think that these guys, the young ones, are communicating the same way we did. They want to be away, they want to text. Actually, it's not true. There are studies in pediatrics that show the young teenagers that you see all the time texting, when it becomes to important stuff, and I'm going to talk about it in a few slides, they like to sit and talk face-to-face. They prefer not to text important stuff. They prefer to call each other and FaceTime so they can see each other in the eyes or sat around and talk about it. So that's important to know. It's so interesting that it's almost giving us an evolution. Look, the average human attention span in 12 seconds. In 2013 is 8 seconds, which is 1 second shorter than a goldfish. So we want stuff fast. It's going faster. People are expecting to get fast. That's why we're all hooked up. Most people are hooked up to those phones, right? And look what's happening. 18 to 24 years old. When nothing is occupying my mind, I reach for my phone. 77% compared to only 10% of 65 years old. They cannot just sit. They need the stimulation. They need something happening, right? They need to be there all the time. The same thing, my phone, I check my phone at least every 30 minutes. More than 50% of the generation one, only 6% of the generation would do such a thing. And it's changing the way that we do social stuff also. Just one example is multi-screening behavior that is completely accepted now. What we're talking about is with people watching TV and not having dinner, watching TV and having the phone and not doing multitasking. I'm not saying answering emails when I'm watching TV. Watching an episode of whatever show you want and discussing it on Instagram, discussing it on Twitter, discussing it on Facebook. So talking about the same thing and see what others are saying about this. Oh my God, I can't believe they killed him. What happens here? It's something that they do all the time. It's just something that's normal now. So the behavior is changing. And this is important to realize because it's going to affect your patients soon. So why we talk about social media, two things for the doctors I think that's very important to know is part of your health advocacy and part of your social accountability. Why? Look, this is the most important social media tools that we have out there. Let's put aside Pinterest, but I haven't used it that much in education, haven't seen many people using it, and it's one of the smallest ones, but let's go with the big one right in the middle, it's Facebook. 1.5 billion people on Facebook. So if I want to do promotion, and you guys do this very well actually at Heart Institute, I will show you. You want to do promotion, you want to do prevention, health advocacy. Shouldn't you go on Facebook? I can put pamphlets, I can put posters here on the wall. How many people are going to see this poster? Oh, there you go. Just a few. Shouldn't I at least try to go and reach the 1.5 billion people who are out there? I'm not saying you're going to reach all of them, but you're going to reach a huge population. And the tool is already there, right? It's not you have to build it. You have to spend money. You have to spend time and work to promote it in there. Other example, completely like Twitter. Twitter has been used more and more in medical education. That's one of the ones I'm going to show you how to a little bit create an account and everything, just to give you something concrete also. But the bottom line is, if your patients are on it, if your residents are on it, if your medical students are on it, it is important for you guys to be on it. And when you don't go on it, that's where the problem comes, here. On Twitter, something that we can do is called chat. It means we sit around at 8 o'clock at night and we say, let's talk about the topic, right? To filter that topic, what we're going to use is a hashtag. The hashtag can be Day of Diabetes. Why? For the people with diabetes. Can be CF, for cystic fibrosis. Can be chronic life. This is RA hashtag, right? And someone studied this. He said, let's see how many people participate in this chat. So from all the people who participate here, you see 56% were patients. Where were doctors? Because if patients are there, they're looking for information, right? It's not the first green one. Those are caregivers. It's the second one. 8 doctors, 1% only. So does that mean that, oh, nobody is okay, we're fine, we're writing our peer-reviewed articles, and we're fine. Patients can do whatever they want, we're fine. No, we're not fine. You know why? Because look, 250, 25% of people on this were unknown. So if this patient is asking a question, he or she is getting the answer. It's just probably not coming from the right person. Because the caregivers are here, others are here, look, advocates, healthcare provider, individual. The unknown are 25% of people who participate in this chat. So what happens is this. Then you have vaccination problems in California. You have whooping cough outbreak in Canada. Why? Because when you have anti-vax movement moving, and they know how to use social media, and doctors are behind the firewalls of paid journals and our own conferences and everything, nobody's there to educate the patients. Social accountability. I wrote for CMAJ blog, a small blog about this, so if you want, you can have a look about the Kardashian index and anti-vax movement and everything. Even if you're not treating pediatric patients, I'm sure you guys have kids or you know a kid that's on these stuff, so it's becoming more and more important for pediatricians to be on it. Why? Because the kids are on it. Their association actually recommends them to learn about social media. And the reason is this. There are advantages. I'm not here to scare people and say, oh, there is all risk, be careful. No, there are many advantages. They do work groups. They find groups that they can join and study together. I don't know, do sports together, this kind of stuff. But also there are risks. Cyberbullying. You have heard about this. I mean, I don't have to go and repeat this. Sexting is becoming a serious thing with teenagers. And have you ever heard of Snapchat? Snapchat is a very fun tool that allows you to take photos that are supposed to disappear in 5 seconds. So you look at the photo disappears. It actually doesn't. You can archive it on your phone, but that's the way they sell it. And it's used for sexting a lot because you can send risky photos hoping that the other guy just looks at it and then disappears. The other guy just have to do a screen capture to keep the photo, right? Facebook depression. Facebook should have its own sociology course almost. Facebook depression is huge. So they did studies after studies, and what they realized is people have the tendency to post lots of positive stuff on Facebook and avoid posting negative on Facebook. And everybody does that. You want to be under your best light, which makes your life look much better than it is, right? I'm here giving a talk. I can post it on Facebook. 2 weeks ago, I hurt my back in the gym. I never put a photo of myself on the ground until shouting in the Facebook, right? So everybody thinks, oh, he's always doing well. That causes Facebook depression for kids. There was a very interesting study that has analyzed how many friends you have on Facebook and how does that affect the feedback you receive from Facebook people. So the thing is, if you have 300 or less, or if you have 1,000 or more, in between, you're somewhere in between, right? 300 or less, if you put something negative, usually you get support. People will say, oh, it's okay, it's going to be fine and everything. 1,000 and more, usually they're going to bash you on it. I gained weight. Yeah, you look fat, definitely. Why? Because usually people don't have more than 1,000 friends, right? But this is something we need to teach teenagers. Why? Because they go out there, how many friends you have? 1,000. Oh, I only have 500. Can I be your friends so I can get to his thousands? But when something bad happens, none of these guys are my friends to support me. So these are the things that are coming into our healthcare. Privacy concern, of course. Digital footprint, we will talk about it with the leadership. I'm not going to get back to that. And of course, groups can add to them. You're not going to believe there are pro-anorexia groups out there to help kids hide their anorexia from parents and doctors. I mean, it's scary when you look into the hashtags that are going around. So we need to know about these. Social media, you can use it, in my opinion, for 3 things: for your professional life, in the education and research. We're all in an academic environment, so it's important to be on solid grounds, right? It's not the hype. Yeah, everybody's doing Facebook, let's do Facebook. No, is there a theory that supports the use of social networking? Yes, it is. It's constructivism and connectivism. These are the 2 theories behind use of social media. You can look at, this is the same theories we use for dividing people in small group and doing PBL with them. Because we know when they're together, they construct better, they connect better and everything. So yes, there is theory that supports using social media to teach people. Our patients are using it. I said this, and here is the data from it again, because people need data. Are patients learning there? Yes. ALS Ice Bucket Challenge. I'm sure everybody heard about it last summer. This is how many searches Wikipedia had from January till July. This is in 1 month. The searches for ALS, how do people learn? They Google stuff. Google sends them to Wikipedia most of the time, right? 18 times more searches in 1 month than the whole year before it on Wikipedia. Why people are looking for it? If you're not there to teach them, other people will. If you're not editing stuff about heart on Wikipedia, someone else is. And let's hope they're doing the right thing, because people are still looking at it. You can go and shout at all the medical students and all the residents, don't Google. They're going to still Google. But you guys do a very good job. I looked at your website, and this is the website right today. Look, right there, education, health advocacy. Heart disease patients who sit a lot have worse health even if they exercise. That's what you should do. And this is great, but you guys, have you seen your website? Yes, you contribute to it also? You guys do blogs? Because I think he has a blog also, if I'm not mistaken. But that's great. I mean, you guys know how to do this, so this is very good. And I looked, you have Facebook, Twitter, YouTube, so you're there. And this is your Facebook page. So the Facebook page, the same thing, very nice, gives the news about something. And Facebook actually analyzed, look, it says even that you guys reply between the 24 hours. So someone who's sitting there replying to people. This is important for leadership, and we will get to that in a second. But let's be clear. To be on Facebook doesn't mean you have to be friends with your patients. Nobody says that. You should never be friends with your patient. Facebook gives you three things. It gives you a newsfeed wall. That's where you get all your information. How many people have Facebook accounts here? Most people do. OK. But also, it gives you two things. It gives you page and a group. And those are the ones that we mostly use in education. Why? You want to keep your professional and private life separate on Facebook. So me, I have a Facebook account. It's for me and my friends and my family. I have a Facebook page for anatomy. The same goes with your Heart Institute. It has a Facebook page. So patient can become and like the face. Why? So if there's a news, it shows up on their news feed. The whole idea is, remember, just a few seconds of attention span. The population does not want to receive information from all sorts of stuff. You ask medical students, they say you send us too many emails. We want everything to be in the same place. This allows you to send everything to their news feed on Facebook. And they're using it. I have studies with med students. Facebook is still the most used in medical education. Group allows them to create groups. You guys want to have a meeting, you can create a Facebook group and share stuff with you in the group. And group can be secret, so you don't have to even tell people that it exists. We use it in medical education usually as a flipped classroom stuff. So what does it mean? I could send you a YouTube video of this talk and then come here and say, do you have any question? Let's discuss it. Same thing with your rounds. Instead of presenting the case here, you send the case to residents through Twitter or Facebook. You look what they discuss, and then you grab the most important things from discussion and you bring it here. For those who are in education, the taxonomy, the objectives of Bloom, you're going from just memorization to discussion, which is a higher order of thinking. That's flipped classroom. So you give whatever can be memorized to them. You say, this is the case. Discuss it. Which one do you think it is? And then you bring the discussion here. I did a study with physicians, and we asked them, these are the people who were using social networking at high levels, and asked them, how do you use them? And what's the benefits of it for your professional life? So, of course, widening of the network. You get to meet lots of people. Access the expertise of peers and other health professionals. If you don't know stuff, you can ask others. Interesting was the provision of emotional support and ability to combat feeling of isolation. And I remember perfectly, there was a lady who was in orthopedic surgery who was being harassed by other ortho surgeons because this was in a smaller community. They were not used to having a woman in OR and everything. And she was thinking of quitting. And just going on Facebook, she found a group that was about female orthopods. And they helped her a lot, even like telling her, no, this is not right. You should talk to your boss about this and that. So it can provide support. Ontario is making cuts. As everybody knows, it's done. It was October. But Ontario physicians are on Facebook with groups. I don't know if any of you have seen any of these hashtags, but these are the hashtags that OMA uses also. So if you go on Twitter, on Facebook, On Call for Ontario, Code Blue, and Care Not Cuts are the hashtag that has been used on social media by OMA. They promote it. And there are many physicians. We are your Ontario doctors. Look, it's like 19,000 doctors in this group. And they talk about the policy that's coming, how much the cut means for you guys, how much it means for family doc, for radiologists, for cardiologists, and everything. So it can be a source of support. Then it comes to leadership. It's completely fine that the leaders don't have Facebook accounts for themselves. I couldn't care less. It's not like I'm getting any money from Twitter or Facebook for selling it. What happens is, if you're not on Facebook or Twitter or I don't know, other social media stuff, you don't know what people are saying about your organization. And that can cause you, right? You can get up one Monday and suddenly for the last week, everybody was bashing your organization because someone tweeted something about it that went what we call viral. And because you have no policy on dealing with social media, it suddenly hits you and you don't even have a clue how to react to this. That's the danger of being a leader and not being on social media. The other thing is what we call the digital footprint versus a digital shadow. If I Google any of you, I should come to a page that you're comfortable with me seeing. It should not be your MD rating that you hate Or if it's good, it should be that one. But if you're not happy with it, that shouldn't be the first one that's out there, right? You need to have a digital footprint. You need to create a presence for yourself. The same way you do your CV, you need to create a digital footprint for yourself. Why? Because more and more people will Google you. If you don't, it's not like you won't be there. You will be there, but people will just see a digital shadow of you. They will see that MD rating that others have posted about you. So it's very important for you guys to have a digital footprint of yourself. What's a digital footprint? It can be a website on the hospital's page. As simple as that. Just ask them to have a nice website. As soon as Google looks for two things, your name and how many people clicked on that page that your name is on it. So the more you have your name on it, you guys have publication, put all the publications there. Don't just put 3, put 10 of them. So 10 times your name is on it. Then put it on the bottom of your email. So each time your email comes to me, I click on it. By the end of the year, you will have 10 times your name on the page, and there are 10,000 people who clicked on it. Next time I Google you, that's the first page that comes up. So you create a digital footprint for yourself. We teach the same thing to the medical students. Why? Because now when they go to CARMS, what they do, they erase their names. They change their names. Why? They're afraid program directors will find them. And I tell them, create something you're proud of. Why you want the shadow to be out there and say, oh, they may find it. The best way to start this thing is to create probably a LinkedIn account. Anybody has LinkedIn? Yeah? How do you guys like it? You use it at all? Not much like me. Eh? You just create it. But that's the thing. You create it to have a footprint. In case someone looks for you, they find you. Yes? How about you? Yeah? Same thing almost? Anybody uses it for something else? No? So LinkedIn looks like a professional Facebook, right? It's a nice place when you can talk about yourself. Say, this is me, how great I am, there you go. And then when people find it, they say, oh, okay, that's him. It's good for conferences. Like seriously, instead of having all those cards at the end of the conference, you give a talk, there are 6 people giving you cards, and then you don't. I just add them to my LinkedIn if they are, and you have the photo, you know exactly what country the guy is from, what he did, and everything. Be very careful if you're creating LinkedIn. LinkedIn is trying to sell itself, right? So if you're creating, it will tell you, do you want me to send an email to everybody, say you have a LinkedIn account? And for God's sake, if you say yes, everybody receives a weekly email of how you joined LinkedIn. So be careful, say no, I don't want to, I will invite the people I want. So just so you know. LinkedIn allows you to create groups. And I know many physicians have groups on LinkedIn to do research, to do practice, to talk about the stuff because it's more professional level than Facebook. So something to look at. So we talked about education, we talked about the professional life, now research. There is a very nice article from Natalie in International Review of Psychiatry about how researchers can use social media. And it tells you in all 4 levels, be it the planning, you can ask for advice from people, is your network, right? You get access to a huge network that you didn't have before. To develop the engagement, to implement, and to disseminate, it gives you another way to disseminate. So if you're interested, have a look at that. But know that more and more journals now are going open access way, right? Public pays for the research. We do the research. It goes behind firewalls that the public has to pay to access. So more and more journals and grant agencies are saying, now you have to make it open. We want you to write a blog about your research so patients can read about it. It's, again, health advocacy and everything. Post-publication peer review is coming. So this is when you publish, and then people review it. Altimetrics is article-level metrics. You see that colory circle beside some of the articles. It shows how many people talked about it on social media. And it's huge, I feel, for conferences. Like RSNA, which is a radiology conference in the US, is happening right now. If you're interested, their hashtag is RSNA15. You can follow it from here instead of being in Chicago. And the top stuff people talk about usually shows up. There are lots of 3D printing happening, it seems, and everything. Simplar is a website that allows you to look for hashtags in healthcare. So you can go there, look cardiology, and all the hashtags from journals and everything will be there. For those who are really in research and basic science, know this. This is from Nature. The 3 tools that the researchers mostly use is ResearchGate, LinkedIn, and Twitter, but the engagement level. So this is the engagement level. The green is the low, the blue is the high. As you can see, the engagement level for LinkedIn and ResearchGate is what we were talking about. You're on it because you're expected to be on it. You say, I'm a researcher, I need to be on ResearchGate. I'm a professional, I need to be on LinkedIn. But most of the engagement and interactions with researchers happens on Twitter, actually. They like to discuss stuff much more here than on LinkedIn and on ResearchGate. So that's an interesting finding that the Nature study had. So I promise you Twitter, that's Twitter. So if you haven't done anything with Twitter, Twitter is very easy. You just go there, you just need an email or your cell phone number to create an account. Your account is your @ sign. You just put a very simple username after it. If you want people to know, you can use your name. If you don't want them to know, you can use any other name. Be careful, CMA recommends if you're gonna post stuff about your job as a physician, you should put your real name so it's transparency with the public, right? Then hashtag allows you to find the stuff, to filter the information, and some of the hashtags that may be useful for you is MedEd for medical education, Healthcare Social Media Canada, and CanMeds 2015. That's a new thing coming for the residency competency-based, right? When you're on Twitter, you don't have to tweet. 40% of the people who go on Twitter every day do not tweet. So you can just look at stuff. Usually it starts small. If you decide you can create something, follow a few people. You can follow Heart Institute. @Heart Institute is your username for the Heart Institute. Follow them and see what they tweet. And slowly you will see, oh, they're tweeting from this guy, from this guy, from this guy. And then you can follow those guys also. There you go. For example, CanMeds, I was talking to someone, I said, when is this CanMeds logo being finalized? Actually, it was finalized in October. And if you were on Twitter following CanMeds 2015, you could even see Jason Frank showing it at ICRE with the new leadership instead of manager and all that. So it's a very nice way to learn stuff without being places. I wasn't at ICRE, but Marcio Gomez tweeted it, who's from pathology. Social media is becoming part of everyday's life for people, right? When Paris happened, actually Facebook now has a safety check thing that you can, if something happens in Ottawa, you can go on Facebook and click and say, I'm safe. That's it. You don't have to text and telephone everybody. Whoever is your friend on Facebook will realize, oh, okay, he's safe. I have his check that he's safe. So they're going to open it as soon as there is a disaster in one region. They're going to allow people who are on Facebook to check in, letting friends know we're safe. I'm not going to tell you where am I and everything because there is no internet, but at least you know I'm safe. The second thing that happened was the porte ouverte. So many people were stuck in Paris, right? And there was a huge match going on and all that, who didn't have anywhere to go. So Twitter started, people in Twitter started using the hashtag porte ouverte, which means open door, telling people, I live in Paris, I have a 2-bedroom apartment. If you want, you can come and stay with me till the situation calms down. So these are the important stuff to know because it can really help you. If you're stranded somewhere, you can get help from social media, and people are using it more and more. But there is also negative. Whatever comes up doesn't mean it's true, right? A tweet that was tweeted 30,000 times, Paris gone dark for the first time till 1889, which is not true. The Tour Eiffel goes dark many times. I think every night it goes dark except on weekends. And it's not true, but 30,000 retweets, completely false. This guy is a gamer, and it seemed he was like, in this program that they game against each other, so the other group didn't like him, so they grabbed this guy's poor photo with the iPad and put a Quran there with the vest and saying, that's your terrorist. And it got how many, like 2,000 things when they're saying, no, this guy is not the terrorist, the photo was fake. So whatever comes out of this is not true neither. And these are the stuff we need to teach. There are more and more people are visual now, right? My students, when I do Google stuff, they say, yeah, we YouTube it first. We YouTube to see if the procedure is there so I can learn about it, right? The ultrasound they were talking about, I'm sure there are many YouTube videos that can show you how to do it and everything. So there are a few of them that you need to be aware of: Vine, Instagram, YouTube, of course, and Periscope allows you to just webcast everything for live on Twitter. It's a very interesting tool. I did it with the conference, as you can see. I just had my phone on a selfie stick, and we just webcast the whole thing online. You guys have a very nice YouTube channel. People have seen the YouTube channel of your, it's very nice. You can recommend it to your page. Like I was looking at it, and it's very nice drawings, very nice, like great health advocacy, social accountability. There you go. Great job on this. So these are the stuff you need to be, there's only 161 subscribers, so you can promote this and make it better. Figure 1 is something the students use a lot to study. It just allows them to share photos of different pathology and everything, so something to be aware of also. The rounds is a new thing for physician when it comes to asking expert. You want to text message someone the EKG, or people are going to text message you the EKG probably, and ask for their opinion. Now there is a secure system that calls the rounds that people can do it on. You need to be a physician to join, and it is HIPAA and PPDA compliant. So you can have a look at this. There are many family physicians on it. I'm not endorsed at all by them. You decide to go, it's on your own. You don't go, it's on your own. But it's a nice thing, and it's new, so you can have a look at that also. And I'm going to end with this. It's the end of the day, but need to talk a little bit about time management. So we need to start learning how to curate this content. Having 200 tweets go per minute is not sending people on Twitter and saying good luck. You need to teach them about curation, how you're going to get this info, how you're going to use the hashtag to find out about conferences. FOMO, do you know what FOMO is? Fear of missing out. Fear of missing out is the fact that the kids can't put their phone away, right? And us is the same thing. You're like, oh my God, probably I got 25 emails. What's happening there and this kind of stuff. With all the physician burnouts we have and all of you working like 80 hours a week and this kind of stuff, the last thing you want is to create a Twitter account and become addicted. And then between patient, instead of like closing your eye and doing some mindfulness stuff, you're checking Twitter and Facebook and everything. What I do is I take 5-minute breaks where I go on Twitter, when I go on Facebook. And then my notifications are off. So even my email is the same thing. If I'm working on the office, I don't get notification. Every hour, I just cut it, and then I go 5 minutes and check everything, come back. Sometimes it's 2 hours, sometimes it's every half an hour because I'm not getting anything done. So it's good to know that. And don't forget, it creates lots of distraction, right? The iPads that we have at TOH and everything, these are very nice. Handover is improving and this and that. But if you're with Madame Thibault and you're seeing her, you should be with Madame Thibault. Notification needs to be off. You cannot have stuff coming in that will distract you from that stuff that you're doing with your patient, right? That 10, 15 minutes is with that patient. So be careful. With more technology comes more distractions. There are professionalism issues. One of the best guidelines that I like is CMA, and Royal College accepts this as being also valid. CMA has social media and Canadian physicians. I put the main points here. As you can see, patient confidentiality is huge. You cannot discuss patients and everything. You need to be professional. You need to know about the communication issues, but there are also benefits to it. So rules is you need to understand the technology. And with this, we never emphasize it enough. Facebook, 1.5 billion people, yes, but one of the worst setting ever. I put a photo and I tag you on it. My photo is private. Your photo session is not private. Whoever is his friend's going to see my photo. Why? Because now he's tagging my photo that was supposed to be private. The photo is no longer private because I tagged him. These are the stuff people need to understand. When we teach medical students, these are some of the things they don't know. They have a car. It doesn't mean they know how to drive it, right? You need to teach them how to drive. They've been on Facebook all their life. These things are still new to them. Oh, really? Yes, all your stuff are public. Really? Yes. Be transparent. We talked about this. If you want to go as a physician, you need to know, people need to know, respect others, and focus on the areas of expertise. CMPA for years told people don't to go on there. In 2014, it changed. It said, OK, you're on it. Let's talk about it. The same goes with their e-consent. And this is something CMPA always asks me to mention. They now have an e-consent form online. It's a one-pager, very easy. You want to grab a photo, send it to your friend that's dermatologist. Just grab that e-consent and say, do you mind I send this to the dermatologist? No, could you please write this down here? And that's it. So they say there is an e-consent on their website that you can use to do this stuff online. We need to teach students in University of Ottawa since 2013. We do a small course for medical students about social media where we talk about the benefits, but also the professionalism behavior. And we tell them, you need to have a digital footprint as a physician now. You have it as a young kid. You had it as a teenager. Now it's time to create one professionally. And they're usually very open. And CFMS, which is Canadian Federation for Medical Students, has guidelines that most of the residency programs also accept as being correct. CAR had them, but they don't have them anymore. I don't know why, but just so you know. So I'm going to end with this from the bulletin of American College of Surgeons in 2015, which says in 2015, the issue is not really whether physicians should use social media, but how they should use it. And thank you very much for listening.